and welcome to Good Life, the health show with me, Puja. Well, this is a show that focuses on providing you with solutions to your health-related issues, lifestyle and much more. Well, viewers, Japanese encephalitis is a virus spread by the bite of infected mosquitoes. It's more common in rural and agricultural areas, but most cases are mild. Now, rarely it causes serious brain swelling with a sudden headache, high fever and disorientation. So, to discuss more on this topic, we are being joined today by Dr. D. Patwari, Senior Consultant Internal Medicine from Hayat Super Speciality Hospital. So, not to waste any more time, I'll straight away move to him and talk more on the topic which we have taken today. All right, thank you so much, Doctor, for joining to Good Life, the health show today. So, today the topic which we have taken is Japanese encephalitis. But before that, I would like to ask you now, can we say that all fevers are COVID, which is nowadays very much prone? People are having a notion that if they are having fevers, so they get a tendency that might be it is COVID. So what do you have to say on that?
Yeah, to some extent it's a fact, because for the last 2-3 years, the entire world has been bombarded with COVID. We have seen how devastating the COVID is. It has caused so many of infection, it has caused so many of deaths. So every single person now knows what actually is COVID. And now most of the patients now after the vaccination, most of the patients are saying double vaccinated, triple vaccinated, patient also got infection. Almost every person got infected at least once or twice. Now what's happening now, they are taking COVID lightly because they think now we have survived the COVID pandemic, now we have got the vaccination and now the COVID infectivity or the violence is coming down. So whenever they have fever, they think, okay, this time I'm getting fever, COVID. Because of the social stigma also, they don't show it to the doctors, they stay in the home for 2-3 days and get well. So the problem lies there, because not all fever are COVID, because apart from COVID, there are many infections that is inside in the society or in the world.
Absolutely.
It might be typhoid, it might be encephalitis also, it might be a scrub typhus also, it might be hepatitis also, and now more commonly in this season, Japanese encephalitis is very important, because people think that this fever might be COVID, they might miss out the other infections.
Absolutely. So one should not think of one kind of disease, because there might be many various diseases as well. So if confusion lies in your head, so it should be cleared out by seeing a doctor. And viewers, I would just like to tell you that our numbers are flashed on your television screen. So if you have any queries regarding the topic which we have taken today, please call up and ask your question. Dr. D. Patwari is with us and hopefully he will be giving you all the answer. Now, Doctor, coming back to you again. Now, as you mentioned that not all fevers are COVID. Now, we are talking about different diseases, and today we are going to touch on Japanese encephalitis. Now, what is Japanese encephalitis, JE, that is also being said, and where it is found?
See, Japanese encephalitis is a vector-borne disease. It is spread by the bite of a mosquito, and Assam and India in particular is endemic. In fact, the entire Southeast Asian region and Western Pacific, comprising of almost more than 300 crore people, are in the endemic zone. So this is a widespread area that anyone can have the disease, and in fact, it's a very common and worldwide reported cases of Japanese encephalitis. I'm talking about reported. It's almost 70,000 per year, and it is responsible for more than 20,000 deaths annually, and those are reported. And these are just the tip of the iceberg. So this is a very important disease. We have to know about this, and we need to be creating awareness regarding Japanese encephalitis.
So why is Japanese encephalitis said as dangerous?
Yeah, exactly. Because number one, it does not have any cure. Number one. Number two, one third of all patients of Japanese encephalitis die. So out of every 10 per patient, 3% die, and 1/3 of the survivors have a permanent sequelae. They have a neurological sequelae. Some patients might have some intellectual impairment. Some patients have some memory loss. Some patient might be paralytic. Some patient must be aphasia, they cannot speak. So they might be having fits. So only 1/3 of the survivors of Japanese encephalitis have a normal life. So this is very, very dangerous.
So this is dangerous. Now we have to understand that how does it spread.
Yes.
So that is also one of the important things. One has to have that information about it. So how does Japanese encephalitis spread?
See, Japanese encephalitis, as I told earlier, is a vector-borne disease. It spreads by the bite of female and of Culex mosquito.
Mosquito.
So it's a mosquito-borne disease. So in fact, we need to know that not all Japanese encephalitis infection will lead to encephalitis. So Japanese infection is different and encephalitis is different. So out of 250 patients will have a full-blown disease of encephalitis. Most of the patients are asymptomatic. Generally, they might be asymptomatic or might be having a mild headache or mild fever. And this disease generally tends to occur more in children. So children sometimes may not complain of fever also. They might complain of headache, of vomiting, nausea. They might be irritable. Then the fever comes. So out of one unlucky patient of 250 patients, they will have a full-blown Japanese encephalitis.
Okay, okay. Now this is a process. Now this is what we are talking about, the spreading of Japanese encephalitis. Now, as you mentioned that Japanese infection and encephalitis is different. Now, how is it being related now? Can you put some light on that, doctor?
See, suppose a mosquito bites you, so the mosquito will transmit the virus into the body. So once you started developing antibodies, then you will be immune, not immune, then the infection will be very, very mild.
Very mild.
But some subset whom the immunity does not develop,
okay,
then the patient, as I told you earlier, 1 out of 250 patients will develop the disease. So this disease, as you asked me earlier, how does it spread? It spreads by the bite of the female Culex mosquito. The virus that enters the blood in the human body is a dead-end virus. So once the person, unlike dengue, in dengue what happens if the person is having dengue, if the virus is in the blood, if another mosquito bites, from that person he can spread to hundreds of different people.
Okay.
But in Japanese encephalitis, once the virus enters your body, it will cause you symptoms. It might not cause you symptoms, but this is a dead end.
Okay, okay. Doctor, we have a phone call. Let's take the phone call first. Hello.
Hi, namaskar. My Ganeshwar Prabhushila deposit.
আমি শুনি আছো আপোনাৰ প্ৰশ্নটো কৰিব
মোৰ মানে মাজতে কোভিড হৈছিল হা কোভিডতে মই ভাল পালো কোভিড নেগেটিভ আহিলে কিন্তু মোৰ মূৰৰ বিষ এটা হৈ আছে মানে এইটো ভাল নাই ইয়াৰ কাৰণে কি কৰিব লাগিব
Okay.
Okay, so should we talk in Assamese?
Yes. Please, please.
English or Assamese?
Assamese.
আপোনাৰ কোভিড তো কেতিয়া হৈছিল? Hello?
I think the phone line cut. Okay, so he recently had COVID, so negative ahise. Okay.
So he COVID jitu hoise COVID hoar pasot okman headache thakibo pare kintu we cannot মানে এইটো Japanese encephalitis নহয় কিয় Japanese encephalitis যাৰ যিটো encephalitis features hobo within 7 days hobo. So COVID or pasot jodi headache to hoise it might be because of mild viral headache. Iman চিন্তা কৰিব দৰকাৰ নাই আৰু কিছুমান signs and symptoms থাকে যত আমি ডিসকাস কৰিম later in the show তো আমাৰ ক্লিয়াৰ হ'ব যে এইটো Japanese encephalitis কোনটো হ'ব পাৰে আৰু কোনটো COVID হ'ব পাৰে.
Okay. I'm sure the answer doctor just gave you must be benefited for you at this point in time. Now, doctor, there is a notion that if we are talking about role of pigs, now that has been only having the notion that swine fever is one kind of fever. Now, how is it related or role of pigs in a Japanese encephalitis?
Yeah, as I told you earlier, the virus when enters the human body, it is a dead-end virus. Okay. So to keep the virus replicating, the cycle replicating, it is the pigs that amplify the virus. So the mosquito bites, generally the Culex mosquito preferentially bites the pigs and the cattle.
Okay.
Generally, they will prefer to bite a pig or a cattle rather than a human being. So the human beings are incidental bitten. So once the virus enters in the pig, the pigs are not affected of the virus, but the pigs will amplify. There will be multiplication of the virus to thousands of times, millions of times, and the pig will be loaded of all the Japanese encephalitis virus. So whenever another uninfected mosquito comes and bite the pig, along with the blood, the mosquito will carry the virus. And this
any kind of mosquito?
No, Culex mosquito.
Okay, Culex mosquito. Okay.
So the mosquito, the virus will enter the mosquito with the blood, and that mosquito, when it bites another human being, from that mosquito, the encephalitis virus enters the human body.
Okay. So this is what we are talking about, the role of pigs.
Yes.
Okay, so firstly, because the Japanese encephalitis insect or the mosquito we are talking about is more prone to the animals, pigs or the cattle.
Yeah, they will not prefer to bite the human beings because human beings, given a choice, human beings are just a secondary thing. So the role of the pigs is that they amplify the virus to hundreds of times, millions of times.
So is there a role of other animals as well?
Yes. Actually,
like many, they keep pets at their home.
Not exactly pets. It is we have to know the fundaments, the life cycle of the virus and the life cycle of the mosquito.
Okay.
So the Culex mosquito generally breeds in water bodies.
Okay, doctor, we'll talk on that. We have a caller, so let's take the phone first. Hello.
Hello, namaskar. মই গুৱাহাটীৰ পৰা কৈ আছিলো আপোনালোকৰ প্ৰগ্ৰামটো চাই আছো ডক্টৰ লগত কথা পাতিব পাৰিম নে
পাৰিব শুনি আছে আপোনাৰ প্ৰশ্নটো কৰিব
হয় মানে মোৰ লাষ্ট ইয়াৰ মোৰ কোভিড হৈছিল ইনফেকচন অকমান বেছি হৈছিল নিউমোনিয়া ফৰ্ম হৈছিল তাৰপিছত মই ঔষধ পাতি গোটেইখিনি খালো কিন্তু এতিয়া বাকি প্ৰব্লেম হেৰি হৈছে
মাজে মাজে মানে দেহাটো অকমান গৰম বা মানে জ্বৰ উঠা টাইপ হৈ থাকে, কিন্তু বেলেগ একো প্ৰব্লেম পোৱা নাই। খালি মানে অলপ জ্বৰ উঠা টাইপ হৈ থাকে। এইটো কাৰণটো বা তেনেকুৱা কিবা ইনফেকশ্যন আছে নেকি এতিয়া, বা সেই কথাটো মই জানিব খুজিছিলোঁ।
নহয়, আপোনাৰ কোভিডটো মানে কেতিয়া হৈছিল আপোনাৰ?
লাষ্ট ইয়াৰ হৈছিলে, লাষ্ট ইয়াৰ জুলাই।
ইমান দিন
জুলাই
যোৱা বছৰ যদি কোভিড থাকে, কোভিড মানে শৰীৰত ইমান দিন নাথাকে।
হয় হয়।
চ' এতিয়া যদি আকৌ যদি জ্বৰ যদি হয়, ছেকেণ্ড টাইম হ'ব পাৰে বা থাৰ্ড টাইমো হ'ব পাৰে, কিন্তু ধৰক যদি
হয় মানে আজি বহুত দিন হোৱা নাই, খালি মানে জ্বৰ উঠা টাইপ হৈ থাকে। ৰাতি যেতিয়া শুওঁ ফেনটো চলি থাকে, তাৰ ভিতৰতে মানে দেহাটো অকমান গৰম বা তেনেকুৱা এটা ফিল এটা হৈ থাকে।
না, তেতিয়াহ'লে আপুনি এনেই চাই ল'ব, টেম্পাৰেচাৰ চেক কৰি থাকিব। কিন্তু এতিয়া বেলেগ ভাইৰেল ফিভাৰো হ'ব পাৰে, কিন্তু যিটো কোভিড আপোনাৰ যোৱা বছৰ জুলাইত হৈছিল, সেইটো ইমান দেৰিলৈকে জাৰ্মছটো নাথাকে। হয়তো ছেকেণ্ড ইনফেকশ্যন হ'ব পাৰে বা যিকোনো নৰ্মেল এই বতৰৰ কাৰণে ভাইৰেল ইনফেকশ্যন হ'ব পাৰে। যদি কিবা ডাউট থাকে লোকেল ডক্টৰৰ লগত চেকআপ কৰি ল'ব, কিন্তু এইটো যোৱা বছৰৰ কোভিডটো ইমান দেৰি নাথাকে।
Okay, thank you so much for calling. Well, doctor, we were talking about the role of other animals.
So we are talking about the life cycle. So the mosquito breeds in water bodies near to vegetation. So near paddy fields, near ponds. So the birds, there are some birds that are aquatic birds like herons, like ducks. Those birds amplify the virus. So the virus keeps on, the cycle keeps on maintaining in the pigs and the birds. And so when there's an outbreak happens, when there is an excess amount of the pigs population or excess amount of human beings, excess amount of mosquitoes, then the outbreak happens from those natural sources to the human beings.
All right, now doctor, let's come to the important question. Now everybody would be waiting for that. Signs and symptoms. What would be the initial basic signs and symptoms?
So as I told you earlier, all those who are infected with Japanese bee virus will not be having a Japanese encephalitis. As I told earlier, it is 1 out of 250 or 300% unfortunate ones who will develop the full-blown encephalitis. So once the patient is having a encephalitis, the certain signs and symptoms we have to be very careful, and we must be very particular that yes, this patient might be having an encephalitis. Now see, in Assam now there is an endemic of Japanese encephalitis. So any person residing in endemic areas, and basically this, as you told earlier in the show, this is a disease seen primarily in the urban, rural and semi-urban areas where agriculture is the major source of livelihood. So in those endemic areas, if someone is having fever, high fever of more than around 5 to 7 days, fever with headache, fever with neck stiffness, fever with irritability, fever with some altered sensorium, if the patient is having a loss of consciousness, if the patient is having fits or seizures, if the patient is having some weakness. So these things show the focus that the infection have reached the brain. So at that point of time, at this moment, we should always keep in mind the differential diagnosis. Yes, this might be a Japanese encephalitis and not corona or not COVID.
Okay. So this is what is the early signs and symptoms one should make out. Now, if we want to tell about that, can we predict Japanese encephalitis early? And what is the first thing if signs and symptoms comes to you, and what is the first thing one has to do? Of course, they'll have to go for a test or see a doctor at the earliest. Now, what do you suggest?
See, now, as I told, the thing is that we can predict that yes, now this season we might be having a excess number of Japanese encephalitis. Suppose there is a high rainfall. Now this year we are having a high rainfall. There is floods. Suppose increased production of pigs, increased pig production is there in that area, increased breeding of mosquitoes. So these are all fertile grounds for development of Japanese encephalitis. Excess of population in that area. So all this makes a good cocktail for having a increased outburst of Japanese bee encephalitis. So if we see now, okay, this year we are having more rain, we are having more population of pigs, then we should try to prevent it before the onset. So these are very important. And this, since why this disease is dangerous, because we know that there is no cure of this disease till now.
So management is very important, doctor.
Yeah, so management, there is no cure. As I told you earlier, there is no cure, and treatment is mainly symptomatic. So the main form of treatment should be in the grassroots level, in the rural level, in the semi-urban level. Everyone should be aware, yes, now there is also a pandemic looming over our head. Japanese encephalitis is a reality. It's now becoming very common. So we should try to find out the signs and symptoms. Anyone having these symptoms immediately, rather than
and one has to be themselves very much cautious about it, aware about it.
And like the campaign that used to be done regarding the COVID, every kid, everyone knows of COVID. Generally, the public awareness must be created. now
Absolutely.
only.
Public awareness must be
created so that people should know that this form of disease is also there. It's a dangerous form of infection and everyone should know about this.
Absolutely. We'll come on that, Doctor. We'll have to just take a break. All right, viewers, we'll slip into a short break, but do come back soon because we have lots more on the other side. Welcome back, viewers. You're still watching a Good Life, the Health Show with me, Puja, and we are having a fruitful discussion on Japanese encephalitis with Dr. D. Patwari. So, Doctor, coming back to you again. Earlier to the break, we were talking about the basic signs and symptoms. Now, we also wanted to know that how can one predict a Japanese encephalitis earlier? You already mentioned about that. Now, talking about the management, now how people has to be cautious because there are a lot of awareness that has to be needed. That is the need of the hour at this point in time. So how hospitals or how a general public can aware other people about Japanese encephalitis? We have seen a lot of hoardings as well. We have seen a lot of awareness campaigns as well. So apart from that, hospitals, what is the plan?
See, the level of management depends on different tiers. So in local community level, so people, doctors and the paramedics should be aware that this patient might be having Japanese encephalitis and they should be more cautious and they should look out whether the patient is having any neurological signs and symptoms. Suppose the patient is having recurrent fits, this cannot be treated at home. It's better to get the patient admitted. And sometimes, as I told you, 1/3 of the patients who die, they die because of other conditions, because of sepsis, because of shock, because of seizures. So this subset of patients who are severely ill should be referred to a tertiary center hospital where ICU care is there.
So that can also lead to some other ailments as well?
No, not directly because of the encephalitis, because the patient might have a seizure. The patient might have a what we call aspiration. The patient might drown of his own saliva. The patient might have choking also. The patient might have sepsis also. The patient blood pressure may fall. So these things are all as a part of the Japanese encephalitis complication. So if the patient condition is serious, if the patient sensorium is low, the primary doctor should identify the subset of patient and should immediately refer the patient to a government hospital or private hospital, tertiary care hospital where ICU care is available.
Okay. Now, prevention part, doctor. Now, prevention part, on that note, what would you like to tell?
See, on the prevention part, I'd like to add one thing, because during our undergraduate days, so last 20, I passed my MBBS 22 years back, we have been taught about malaria. So everybody thought, we have been taught fever in Assam, fever in Northeast, number 1 is malaria, number 2 is malaria, number 3 is malaria.
Only
we have been
malaria.
taught like that. Then 4, 5, 6 comes different issues. But now because of public awareness and government intervention, last 5 years, I have not seen a single patient of malaria. In fact, only 3 years back, I saw one patient of malaria and that patient came from Bangladesh and I forgot the medicine. So because
we can understand about the awareness, how
exactly that is the point I want to emphasize. Because of public awareness, because of government initiative, now malaria is nowhere to be found. I hardly see any cases of malaria.
Because the root cause was known and the people were so much aware about it.
Great, exactly. So that is the reason why Japanese encephalitis can also be like malaria. So after 2, 3, 5 years, let's hope we'll have a talk discussion. Again, you and me will talk. One day there was a disease called Japanese encephalitis. So since this is a vector-borne disease, we should be very particular in preventing the disease, because since the cure is not there. So how to prevent? Number 1 is public awareness. Number 2 is prevention of mosquito bites. So this mosquito bites both indoors and outdoors. So it's some mosquitoes preferentially bites indoors, some mosquito bites outdoor. But this mosquito will bite you indoor or outdoor. So as a personal level,
or daytime or the night?
Generally they prefer dawn and dusk.
Dawn and dusk.
Dawn and dusk, and they prefer the hands and the legs. So we have to prevent during this season. So in home we all use the agarbattis or mosquito coils. Whenever we go outside, as I told you earlier, the children are more vulnerable. Parents should make sure that children, when they go out to play or when they go out to school, they should always cover their hands and feet.
Now, though we are talking about rural areas, but we have also seen in cities as well, urban areas as well, where the drains are open, if you have a lot of like gardening around you. So, of course, the mosquitoes may evolve there as well. So, still you have to keep a track of
everything. These things, basically, generally we are speaking of more in the rural areas, but it might also occur in the urban areas. Because in many parts of India, sometimes we see the pocket of infection in urban areas also. So, we should be aware of that. We should keep ourselves, we should protect ourselves, and regarding these things, regarding the role of pigs and the cattle, as I discussed earlier. So, those who are in pig farming, they should keep the farms at least 100 meters away from their home.
Okay. And does disinfection also is being like
disinfection regarding the mosquito things, mosquito control, definitely this is going to help. Mosquito control like fogging or other DDT spray will not only kill mosquito, will kill also other mosquitoes, and this will also prevent the spread of like malaria which is basically not seen nowadays. It will also clear the dengue virus also.
Now, doctor, if we talk about in the northeast and Assam context especially, now we have seen a lot of cases of Japanese encephalitis. We have been hearing it here and there. Now, why is it seen in Assam so much? Is there anything to
basically
do with
cultivation?
Cultivation.
Paddy cultivation, because paddy cultivation has got peculiar thing. We need to lots of water in the field. So, this is the breeding ground of mosquitoes, specifically for Japanese encephalitis.
So, we have also heard about vaccines, doctor. Now, how much is vaccine helpful?
See, vaccines in particular is helpful if given early, because children are much more vulnerable. So, vaccination universal program, it has not been adopted by the government of India, but vaccine is given in vulnerable areas. Where Japanese encephalitis is endemic. So, government gives vaccine to children. So, around the age of 9 to 12 months, one dose, and the second dose is given at the age of 16 to 24 months. So, this is in Assam, in some areas where Japanese encephalitis is endemic, it is given routinely.
Now, doctor, would you like to share some incident, or like to share some case of yours as Japanese encephalitis are evolving now? If any person or any patients with the signs and symptoms comes to you, a lot of questions arise in their mind as well. A lot of counseling has to be given these days, because as you said that all fevers are not COVID. Now, on that note, how do you counsel the patients, and what is the first thing you ask the patient to do with?
So, any patient coming with fever, definitely we don't take it as a Japanese encephalitis, as we told earlier.
Depends on the temperature as well, and how long
not about the temperature, depends upon other signs and symptoms. So, suppose we are talking about COVID or any viral infection, patient will give history of cough, history of sore throat, history of sneezing. So, this is not a suggestive of Japanese encephalitis. So, if the patient comes with the history of sore throat, cough, sneezing, and all the family members are affected with the same disease, so it might be COVID or any viral infection. And we specifically ask where the patient resides. Suppose we have to ask, suppose the patient coming with history of fever for 5-6 days with severe headache, no signs and symptoms of cough, no signs and symptoms of sneezing, no sore throat. So, this is not a viral sore throat or upper respiratory infection. So, this might be something else. This subset of patient, we ask whether you have been to rural areas recently for last 5-6 days, whether there is a change in temperament, whether you are irritable. Then we see for other signs and symptoms like neck rigidity, and whenever we suspect, then there are certain tests that we do to find out whether the patient is actually having Japanese encephalitis or not. And the most common test that we do, we examine the cerebrospinal fluid. We take the fluid from the spinal cord, the cerebral CSF test, and we check it for Japanese encephalitis, and this is the gold standard.
So, what the test you mentioned just now, you take out CSF. So that is mandatory to rule out exactly what is the problem?
Not every patient require, but if you have doubt.
If you have found some kind of symptoms.
If the patient is giving symptoms, in CT scan also we find symptoms that patient might having a features of encephalitis, if the patient is comatose, if the other normal tests are negative, very high likelihood of Japanese encephalitis. We can do the blood test also. Blood test is not that much predictive, but the CSF test, that is very diagnostic. So,
is CSF test on like children? We are talking about adults as well. So, is it safe?
Yeah, it's safe.
It is because if everybody normal blood test is a big thing.
It is normal.
Taking water out of the spine, so it's something one has to.
These are not done by technician. This is done by specialized ICU doctors. So, this is done in a very sterile situation. So, it is relatively 99.99% safe.
Okay, okay. Now, Doctor, show is still going on and we have a lot of people watching it. So what message do you want to give to our viewers who are watching our show at this point in time?
So basically the take home message is that we should try to know what are the signs and symptoms of Japanese encephalitis. Not all fever are because of COVID. If anyone resides in endemic area and if the patient is having high fever for last 5-6 days with headache, with neck stiffness, with altered sensorium, please visit the local doctor immediately and get yourself treated.
Okay, and any message on the physical activity as well, and also on the dietary part, if you want to pass on for that?
See, physical activity and diet is of paramount importance, and now I think the worldwide have understood the importance of good nutrition and healthy lifestyle, because during COVID we have seen lots of patients surviving the pandemic without any difficulties because of healthy lifestyle, and we have seen patients dying, young patients dying because of unhealthy lifestyle, obesity. So we should always try to lead a life with healthy lifestyle.
Healthy lifestyle is the key of your healthy health as well, because if you have to understand about the diseases, it's better to see a doctor at the earliest, isn't it?
Yeah.
And if you find any kind of signs and symptoms, one should not stretch it for a long.
Don't stretch it longer.
Stretch it for a long, because if the temperature is high and you see that it's okay. Now we have seen that off the counter medicines have also been taken, and people search a lot of things on internet. And they think that they are doctors itself. So but we always suggest that it's better to see the doctor and get prescribed with the proper medicines, unless and until it is mild, that's okay. But do you would like to tell the viewers who are watching our show that off the medicines is not required, because if you see a doctor, that's more prescribed?
Yeah, now we have got lots of things now. We have got 108, we have got 104 services there. Now the rural health service is very robust now. Everywhere you find doctors. Any doubt, please consult the local doctor.
Okay, okay. Thank you so much, Doctor, for those valuable information at this point in time. I'm sure the viewer who have watched our show must be benefited with the answers Doctor gave. And with this, we have come to the end of the show, and we hope that we were able to answer all your queries in the best possible way. And in our next episode, we will be discussing on some other important health issues. So if you have any queries, do join us next Saturday at 3:30 p.m. live. Till then, stay healthy, stay fit, and keep watching Northeast Live. Goodbye.